Josh, we are at your beck and call.
Well, good afternoon. I'm Dale Bratzler. I'm the University Chief COVID Officer. I am going to give just a brief update on where we're at in the state with respect to COVID-19 cases. I do have a handout that will be distributed at the end of this interview. So I think most are probably aware that the State Health Department reported 1,077 new cases in Oklahoma today. That takes our total confirmed count up to 51,746 cases. There are 715 deaths in the state. I was looking back at last week's data. We've actually had more new cases this week than we did last week. So today we're at 4,849 new cases in the state, and we've had 71 Oklahomans lose their life to COVID-19 within the past week. The other thing that has changed now with the uptick in new cases today is that the 7-day rolling average of cases in Oklahoma is also up. It's up over 690 new cases per day on average. And although the 14-day trend, luckily, is still on a downward path, it's flattened considerably. So I really think that right now we've plateaued with our new cases somewhere around 650 to 700 new cases on a daily basis in Oklahoma. Clearly, Oklahoma County has had the most cases in the state and had a large number of cases that were reported today by the State Health Department. Tulsa County was second today, and then Cleveland County also had a substantial number of new cases today in the state. A couple of points about testing. When I look at the percent of tests that are positive in Oklahoma this week, right now we are at 9.7%. That's through the first 4 days of this week. Tonight, the Friday data is always updated late in the day, so by next week I'll know where we're at for the whole week. But 9.7%, which is down from our peak of about 10.5% 2 weeks ago. However, we're actually up in terms of the number of tests that have been positive since last week in the state. And finally, as of yesterday, there were about 466 people that were in the hospital with COVID-19. Again, as I've highlighted so many times before, half of those patients are in the intensive care unit right now. And sadly, we know that when you have that many people with confirmed COVID-19 in hospital intensive care units, we're going to continue to see some more deaths in Oklahoma. Everyone is aware, I think, that at least 78 to 80% of all of the deaths in Oklahoma have occurred in patients that are 65 years of age and older, though there are obviously 20% of the cases are in younger age groups than that. There have been a couple of nursing home outbreaks in the state, so again, we have to maintain our absolute vigilance with these really high-risk populations. Before I stop my prepared comments, in the handout that's going out today, there'll be a one-page table that comes from the Centers for Disease Control about testing, comparing PCR testing, the nasopharyngeal swab test, the PCR test that tests for actual genetic material of the virus, the gold standard test, versus antigen testing, which is also done typically with a nasal swab, is much less expensive, often done in urgent care centers because it's much easier to do and gives you very rapid results, usually within about 15 minutes of putting the specimen into the machine. These tests are both commonly offered in Oklahoma. Again, the gold standard test for diagnosis is the PCR test. However, if you look at this table that comes directly from the CDC, it highlights that the specificity of both the PCR test and the antigen test, which is testing for viral proteins, not genetic material, but proteins, are both very, very high. In other words, if you have a positive PCR test or if you have a positive antigen test, you very, very likely have COVID-19 because there just aren't other things that will make that test positive. However, the difference in the test is the sensitivity of the test. So PCR test can be negative falsely in a person who's infected if you do the test too early. So if you're exposed to somebody with the disease and then you get tested tomorrow, there's a good chance the PCR test will be negative. So there are false negatives with that test. But the big difference between PCR test and antigen test is that overall antigen tests are less sensitive, meaning that if you go someplace that's doing the rapid antigen test and you're symptomatic, you think you've been exposed to somebody, you have a cough, fever, some GI symptoms or something else, so you actually think you may have COVID-19 and you get a negative test, please remember that 20% or more of antigen tests will be falsely negative. In other words, the result will come back negative even though the person is infected. That's the difference between PCR and antigen tests. So both tests, when they're positive, have high predictive value that you have COVID-19. But if an antigen test is negative, you may want to consider getting additional testing because we know that the antigen test, even in the company literature for the companies that make those tests, report up to 20% will be falsely negative. So it's an important distinction to understand, but again, as was highlighted this past week in Oklahoma with OSU, with the sorority that tested positive, the 23 sorority members, they had antigen tests which were positive. So I'm convinced that they have COVID-19. But those tests don't get reported by the state. They get reported to the Centers for Disease Control as probable cases, which lowers our case count for anybody that's going to most typically urgent care centers that are doing the rapid antigen tests.
Wow, that's interesting. Okay, I had a couple questions out of Tulsa today about the death rate. It says the death rate in Oklahoma has ticked upward in recent weeks as the 7-day rolling average of new cases trends back down. Are deaths just now catching up from the spike? Are some of the death reports being delayed?
Yeah, so it's a real good question about why are we seeing this uptick in the number of deaths at the same time that we've seen this drop in the 7-day rolling average of new cases in Oklahoma. So deaths are always delayed beyond when a person is diagnosed with the disease. And in fact, if you look at the weekly epidemiologic report that the Oklahoma State Health Department puts out, they note that there's often a 2-week delay between the onset of symptoms and when a death actually occurs in a person who succumbs to the disease. So in mid-July, late July, we saw a big peak in new cases in Oklahoma, and at the same time we're seeing a lot of people who are in the hospital. We typically, I think hospitals have gotten much better at taking care of patients with COVID-19, but the important thing to note is that the death usually doesn't occur right at the time of hospitalization. Patients are often in the hospital for weeks receiving intensive care before they die. And that's why I keep making the point that as long as we have more than 200 people a day in hospitals in the intensive care unit, we're still going to see deaths in the state.
He said also the CDC director says he anticipates death rates will start to fall. Is there optimism for that?
Well, I think we will see reductions in the total death rate once we start seeing fewer hospitalizations, which is directly tied to the number of new cases that we have. So in Oklahoma, we know that about 10% of the people who seek out, get a test done and it's positive, about 10% end up in the hospital. And of those, 2 or 3% probably end up, of all the cases, 2 to 3% actually end up in the intensive care unit. So we know that as long as our case count is high, there were 1,000 new cases today alone, so we can estimate that about 100 of those people will end up in the hospital sometime in the near future, and maybe 20 of those people might end up in an intensive care unit bed. And as long as we have patients who are that sick with COVID-19, we're going to see additional deaths in the state.
All right, maybe several questions in here. A White House report shows Oklahoma in the red zone for COVID cases, and they recommend closing bars and a statewide mask mandate. What are your thoughts?
Well, I think, so the question is about the White House report that was sent out, I think actually leaked, but it was basically the report from the time that Dr. Deborah Birx was here. And I'm not sure what map they were using that has Oklahoma in the red zone, but they had us in the red zone because more than 10% of the tests that we run in the state were still positive. So that put us in the red zone. And in that report, they explicitly recommended a mask mandate, which I think most people know that I've been a strong supporter of mask mandates. I think we should have it across the state. Again, I want this to go down. I want to see the cases go down. I want to get this over with. And maybe the best way to do that would be to have a mask mandate. That report, I just had a chance to glance at it, also recommended that you close gyms and bars because we know that those are hot spots for transmission of this virus from one person to another. They recommended that restaurants stay open but use carry-out rather than having a lot of in-restaurant seating. And so those are just the recommendations. The report is available now on the internet and can be downloaded.
A study by researchers at Massachusetts General and Mass General Hospital for Children claiming kids who seem healthy may be more contagious than sick adults. Is there anything to that?
So there's been mixed messages on this. So first, we know that kids get infected. The American Academy of Pediatrics reported that this week we surpassed 400,000 confirmed cases in children in the United States. So let there be no doubt about it. Kids are not immune to this disease. They get infected with this virus. There have been several studies that have shown that though they're not as likely to get infected as adults, when they do get infected, they shed a lot of virus. So the big question then is, are they the super spreaders? In other words, do they spread the disease to adults who are around them? Because they definitely shed the virus. And I think the science is not complete yet in terms of how many cases occur because kids spread it to adults. I think it can happen for sure. But one of the things that we know about kids is they don't cough as hard, they don't, they're smaller, and so they may not shed the virus as far if they're coughing or sneezing as an adult does. So there's been mixed studies about how much disease is spread because of children who are infected, but let there be no doubt about it. Kids get infected and they can spread the virus to others, both to other kids, but also to older people.
Today, the OSDH announced its plan to test teachers and staff monthly. What do you think of that?
So I think testing teachers is one of the strategies, surveillance testing, to look to see. It will provide us some information about spread of the disease in that particular population. Honestly, doing it once a month may or may not help us very much, because remember that when you do a COVID-19 test, it tells you your status that day.
Excuse me, I have a reporter saying that the audio is not working. Let's double check and make sure.
Dr. Bratzler, could you go and say something for me real quick?
Yeah, testing 1, 2, 3, 4.
I've got audio here. I've got audio here.
Okay.
Everything's good on our end.
Okay, let me just let them know that it does seem to be good on our end. All right, sorry about that, Dr. Bratzler.
So the question was about the state health department's plan that they announced that came from the governor to test all teachers at least once a month. And I know they have a contract with a lab to actually do that testing. Just a couple of things to think about. One, a test done on anybody tells you your status that day. It doesn't necessarily tell you, that they might not be infected the next day. So for surveillance testing once a month may or may not be enough to actually test. I think it will provide some useful information to us about the transmission of the virus in the school system, and it may provide some early warnings if we see teachers start testing positive. But again, doing it just once a month may not be enough to actually do good surveillance.
Do you have another White House coronavirus task force question? There's a report, it says that reports that have been sent to Oklahoma state officials but not shared with local health officials. Is it important that the information reach local municipalities?
Well, I think, information that comes out around strategies to prevent COVID-19 are important to disseminate. And again, the report that I saw earlier today is one that actually happened, that came out, that supposedly is the follow-up from Dr. Deborah Birx's visit, and it is now available. It's on the internet that people can download. It was leaked by one of the searching organizations. I don't know who leaked it, but it is out there on the internet.
Anything else we need to know about this week?
I think those are the key things. Again, I strongly support any recommendation that we have a mask mandate, just because it's really, really important that we slow the spread of this virus. Right now we've plateaued again, and with opening of schools, primary, secondary, and college campuses, I have real concerns that we could see new spikes in the number of cases in Oklahoma if we don't get just really religious about practicing physical distancing, hand hygiene, wearing a mask all the time.